Another edition of Johnny Stocks 212. Other people trying to sell you something. I'm just here to find those A winners, go getters, trend setting companies to invest in. Thank you for joining me wherever you may be. We got a great show for you today. Today we're talking about an exciting biotech company called VBL Therapeutics. Please read the disclaimer on your own time. So VBL Therapeutics, what got me excited about them is they're developing a revolutionary way to target people that have immune-inflammatory diseases. So let's jump right in. Let's look at the leadership team. Professor Dror Haradis is the MD. Dr. Dror Haradis is the CEO and MD. Heard on a bunch of interviews. Really sounds fantastic. I'm always looking for these companies that have fantastic leadership teams. So VBL Therapeutics, they're really looking. They have a candidate VB601, which is trying to target antibodies for the immune-inflammatory. They got phase 1 trials later this year, hopefully, that potentially has shown disease-modifying activity. And that's pretty incredible. And the different models that they've shown, rheumatoid arthritis, inflammatory bowel disease, and even in one model, it showed multiple sclerosis. So this is really revolutionary. I'm really excited to see this. What people don't realize is, monocytes are the key driver in the inflammatory process. They maintain the chronic stage in various inflammatory diseases. And monocytes are the type of immune cells that forms into the bone marrow. They travel through the blood to the inflamed tissue. Now, what VBL Therapeutics is developing a monocyte targeting technology specifically for these limited chronic inflammation. And the way it controls the ability to migrate or called walk to the inflamed tissue, the surface of the monocytes, is this protein called MOSPD2, the mono walk receptor. So I'm really excited. They have other things in their pipeline, but this monocyte targeting technology is what got me intrigued about this company. So let's look at the pipeline. So they got gene-based therapy. They're in randomized controlled trials, phase 2 for colorectal cancer and recurrent glioblastoma. But this monocyte targeting technology, VB601, is the one that I'm really interested in. Now, they're still preclinical. Hopefully later this year, they get into phase 1 studies. Remember, they're going to look at phase 1, and if it goes to phase 2, they got to look at safety. Is it safe? What dose? They got to establish a dose. So their lead candidate, this VB601, it's a proprietary monoclonal antibody that binds to that MSPD2 receptor. And hopefully block the ability for those monocytes to reaching the inflamed tissue. And this is really a different approach, big time. I mean, most of these anti-inflammatory agents, they're targeting T lymphocytes, B lymphocytes. They're not targeting monocytes. So this is really, something that I'm interested in. I definitely want to see them get into the phase 1 trial. If the medication, this monoclonal antibody proves to be safe, I think so far their models show that it's, obviously preclinical stuff, not even into phase 1 trials yet. So they're not even testing in humans yet. I want to specify that is pretty exciting. So this is definitely a company I want to keep an eye on. They have the nivolumab in combination colorectal cancer that already is in phase 1 trials. Those two are in clinical trials. But this monocyte targeting technology is really exciting to me. So let's take a look at the stock price. So stock symbol VBLT, Vascular Biogenics. Time of the video, they're trading at 16 cents. Okay, so this has been hammered. It's down quite a bit the last 5 years, but I'm still interested in this company because of that technology. Hopefully that receptor works out. If they get into phase 1 trials and the dose is safe, I like the preclinical work so far. Okay, the preclinical work is what excites me. I'm still going to take a look at this company, they get into phase 1 trials and it moves to phase 2 trials and they have an established dose, I'm definitely going in. Right now, I'm still in the waiting pattern. I want to see what the phase 1 trials, if they start enrolling, is it safe? What doses did they use? Because there's a lot of opportunity with this company. They have a really compelling pipeline, potential therapies with this monocyte technology. That's all the time we have for this video. If you did enjoy this video and content I'm creating, please make sure to hit the subscribe button. It's completely free to subscribe. It really helps my channel grow. I'll continue to monitor this company. And as always, thanks for watching, and I hope you have a wonderful day.